How to read your prescription label. Labels may look different depending on which pharmacy you go to, but they all have the same information. Your label contains important information including your name, address, and phone number, the name, address, and phone number of your pharmacy, the prescription number, the date the prescription was filled, the number of refills remaining, the expiration date, your prescriber, the quantity you are receiving, medication directions, and the name and strength of the medication. Reading all that information on a small piece of paper can be overwhelming, so let's go through each part step by step. Right next to your name, you can find the RX number. This is your medication's prescription number. This allows the pharmacy to locate your medication amongst other ones in the system. The pharmacy often uses this number to fill your medication when it runs out. To the right of the prescription number is a date. This is the date that the pharmacy filled your medication. Below your name and address, you'll see the medication name and strength. If you know what your doctor prescribed, you can check that you're receiving the right medication. Do not hesitate to ask your provider if you are not sure what the medication is for. You may also ask your provider if the medication is brand or non-brand, also known as generic. The generic name will be different from the brand name, but they are the same medication. Generic or non-brand medications are the same as the brand name. Generics have the same active ingredient, the same effect on your body, they have to meet the same FDA requirements, and they are equally safe and effective as brand medication. They have differing inactive ingredients, and they often cost less. Brand name medications have a patent when they are first made. This means that no other company can make this medication. When the patent runs out, other companies can begin making generics at a lower cost than making it from scratch. Since it costs the company less to make, it is made available to you at a lower cost as well. Below the medication name is the medication directions. If the directions say once a day, it means take it every 24 hours. Twice a day means every 12 hours. 3 times a day means every 8 hours, and 4 times a day means every 6 hours. With meals means take it with the first bite, as needed means take it only when you feel sick, and as directed means take it how your provider told you to. Quantity and refills come next. Quantity is the amount you are receiving, and refills is the number of times you can go to the pharmacy after the first time you pick up your medication. Make sure to get your refills on time. If you go too early, your insurance may not pay for your medication. If you go too late, you run the risk of not getting your medication when you really need it. It is best to get your refill when you have a week's supply or less. You can also call the pharmacy to ask when you can refill your medication. For example, if it says quantity 30 and refills 2 before 12/17/12, that means you are provided with 30 tablets. If taken daily, this should last you almost 1 month. After you run out, you get 2 refills, meaning you can go to the pharmacy to fill it 2 more times, but you have until December 17, 2012 to do so. After this date, your refills are no longer acceptable. If you take your medication properly and get your refills at the appropriate times, this prescription should last you a total of 3 months. If your prescription says no refills, that means there are no refills left on this prescription. The pharmacy cannot fill the medication until you call or see your provider first. Your prescriber's name should be on the label towards the bottom. Your prescriber is normally your doctor or nurse practitioner. This is the person the pharmacy calls if there are any questions or problems with your prescription. If you have any questions about your medication, you may also call this person yourself. Your medication has a use-by date, also known as the expiration date. You should never take medication past the date listed on the label.
Now it's time to test yourself.